If you've been considering adding lasers into your office, especially lasers to help your patients with autism or neurodevelopmental delays, ADHD, etc., or even for neurodegeneration, then you've probably considered either the Erchonia devices or the Avant devices. And if you've been curious about what's the difference between these two devices, such as which laser has more research supporting it, and specifically we're saying supporting its particular power settings, its wavelengths, and also its pulse frequencies. And if you're curious about, is higher power better? Does that make a laser more effective? And does deeper penetration mean better results? And what does the actual research say about that versus what does the marketing literature say about it? Those are important things to think about, and I want to try to separate any brand loyalty from just looking at research data. We're going to try to make this about what the literature says, but this has become necessary because Avant makes higher power a central comparison point, and in their marketing, they specifically target the Erchonia lasers, and they have them on their website. And if I'm at a conference or anywhere, we a lot of times have people come over from the Avant booth saying, hey, I was just there talking to the sales rep, and they said that their laser is better because it penetrates deeper and it has higher power. So I want to dive into what the research actually says, since this is such a common question out there. And we're going to look at those studies performed with each device, and then it's going to be up to you to decide. I'll show you the data. Go on to PubMed and read it for yourself. So don't even trust me on it. Just, I'm going to share with you the studies. You'll see them in here. Go read it for yourself and then make an informed decision on what the evidence seems to support. That's what I do as a researcher. In addition to using lasers for the last 24 years, I have also been the co-lead researcher on 3 new and unique FDA clearances. Let's get into the meat of why most of you are on here. Looking at the differences between Avant and Erchonia. They're going to talk about higher power and deeper penetration. Does that mean better results? Here's the study that's commonly referred to as the Autism study. It was done and published in 2018 by Leisman and Machado. This was done on the Erchonia FX series laser, where they used a 640 nanometer red, 17.5 milliwatt scanning laser, where there are basically 3 rotating diodes going around the head to cover it. And then in the placebo group was an active LED. Same milliwatts, same wavelength was being done, same kind of coverage on there. Let's see what the results showed. This was doing 5-minute treatments twice a week for 4 weeks, 8 total procedures. So here is the actual functional MRIs of the kids, some of the kids involved in the study. At the top, there you see brain activity, like neuronal activity, and blood flow before laser is applied. Now, one of the arguments that gets made is saying that, oh, you need a deeper penetrating laser like 800 to 1064 to make a difference. We hear this all the time. So this is why Erchonia set up these functional MRIs to show that even with a laser that's not penetrating as deep as some of these other wavelengths, you can still show changes in actual function. And there you see after 5 minutes of the child just sitting under the laser, no co-activation, no kind of exercises whatsoever, just sitting passively under the laser. In 5 minutes, you see a change in blood flow and neuronal activity. And that was something that was visible in a very short time. Now, in addition to that, they also had the parents fill out the aberrant behavior checklist. That is a 57-point checklist for behavior changes like hyperactivity, non-compliance, inappropriate speech. So what you see when you look at these results here is that there's their baseline. The solid line is the actual laser group. And you see at 2 weeks, they're already getting better. 4 weeks, it's even better. What I find really significant is look at where they were at 8 weeks. Even 1 month after the laser was actually stopped, the kids continued to get better. Now, what this is showing you is that a 640 nanometer laser at just 17.5 milliwatts didn't just produce temporary changes, it produced some longer lasting changes on there. In contrast, look at the dashed line at the top. That is with the red light device. And again, it was not shut off, it was active, but you don't see those changes with the group that was receiving red light. Now, 6 months later, they took the kids who were in the red light group, crossed them over, and gave them the laser. They got the same kind of result on there. So it clearly showed they basically became their own control group where they got LED first and then laser, showed a clear difference with that 6 months later. And when we look at the overall outcomes, let's take a look over here at the global score on the aberrant behavior checklist. You saw a 60.5 reduction, 0.5% reduction in their overall symptoms in just 8 sessions on there. That was just with the red. Now in my office, we also utilized green and violet, but that wasn't included in the study. But with the 640 nanometer visible red, we saw these clear changes with these kids. Now let's take a look at what the Avant research is. So in order for me to do this, I did a manual search on PubMed. I also utilized 2 AI agents, Claude and ChatGPT, and I put them in their highest research mode. And I also looked at the Avant website as well. I was looking to see if there were any peer-reviewed human or animal studies evaluating the Avant laser, and I couldn't find any, and neither could the AI, and there's nothing on the Avant website. I looked for published trials for any of their laser device configurations, and I couldn't find any for that, nor for their particular power settings. I did, however, find one publicly posted single child autism case study, but it was not identified as a peer-reviewed journal publication. Also, the AIs were able to uncover a couple of ongoing trials at some universities in other countries, but as of the time of the recording of this video, nothing has been published. I did find on Dr. Robert Melillo's Avant laser webpage links to the published autism laser study. But if you take a look at that over here, you will see that on his website, there's the Avant laser that he's selling. Down there, you click on research paper for low-level laser in children with autism, and you're going to expect that it's going to be an Avant study, right? But here you see this pops up with this study on PubMed, that's PubMed indexed, effects of low-level laser therapy and autism by Leisman and Machado. This is basically the Erchonia laser study that's on this website underneath the Avant laser. So it gives it the appearance of supporting that particular laser for autism, but it actually doesn't, because it's completely different. So if we take a look over in this next slide, this will show you the differences between the Erchonia and the Avant lasers. And this is why having that paper on a page trying to support the Avant laser, it's not accurate, because the laser used in that study was 640 nanometers and only 17.5 milliwatts on there. A rotating scanning diode so that the treatment is spread over the whole cranium. Conversely, on the page that is on, that was for the 1400 milliwatt infrared, completely different wavelength. It interacts with tissues in a completely different way. And for 1000 milliwatt red. And again, when you increase the power, you can get different results on there. And this is what we'll show you down at the bottom. Look at this, what it says with research. A lot of times people will look at the Bunsen-Roscoe law of reciprocity, where you would think if you have a 100 milliwatt laser and you do a 10-minute treatment, because the dose is the same as a 1000 milliwatt laser in 1 minute, you should get the same results. Theoretically, it sounds good, but there's something called the reciprocity failure. This means that if you deliver the same joules at different irradiances, which are power levels, and exposure times, you can get completely different biological results. And I'll show you, if you go with the higher you go with the power, and that dosage, as a dosage starts to get higher, you can actually start to get diminishing returns, and eventually you can get the opposite of the effect of what you're trying to do. So we've seen the comparisons between the Avant laser research on autism and the Erchonia laser research. Let's take a look at an example here. This is by Huang and Hamlin, and they're talking about a longer wavelength may mean there's deeper penetration, but that doesn't mean that you get better results. So we're looking at this in a TBI model, and when you take a look at the results, this is the key thing. You look at the results there in that graph. Neurological severity score over time. The control group and the 980 nanometer group were almost identical. When you look at the red at 665 and the green line at 810, those are red and infrared lasers, you have roughly the same outcome. This is just one example showing you that that whole claim that you need the infrared to affect the brain is just not supported, not only by Erchonia research, but it's also not supported by independent research that's available on PubMed. So let's look at another thing here. These are just a few things will pop up with violet lasers, with green, with different wavelengths of red, showing visible light wavelengths impacting brain function. I even have a video of the owner of an infrared laser company who was even talking about applying laser on the brain, and he said that he's been shocked to see that the research is contradicting even the position that he had in the past, where he had that same belief that you need a deep penetrating laser in order to make a difference on the brain.
Do we have to actually reach the target to work? And by the way, all the wavelengths were different as well. It doesn't seem like wavelength is critical. This is a very poor performing wavelength in terms of penetration. This is 629 nanometers. It's not a great penetrating light compared with what Francisco was using at 1064, or the others were, there was some 830 something and 870 nanometer in the other one. Those are relatively good penetrating wavelengths. This is low irradiance, poor penetrating light, and yet people are having effects on this. So now I don't know what to believe about dose anymore. I don't know what to do with that information. Besides, as you know, I don't believe you anyway, or any of these people, about their parameters, because they probably haven't used the right instrument anyway. So anyway, that's why I don't believe any of you. I don't believe even what we do here in this place. I don't believe anybody, so I don't even believe myself in this field.
He is admitting that what they were saying for a long time is not accurate, because he talks about how the visible wavelength, like red lasers, even without a deep penetration, that energy can get picked up by the blood vessels that can even go through the cranial bones and go through the sutures, or it can be picked up distally. And he talks about the distal applications and impacting the brain. And here's the thing, when the Avant lasers talk about that you need this deep penetrating beam to affect the brain, this review paper by Hamlin showed that here, if they shielded the mouse brain and laser to the body in multiple studies, Johnston, Farfara, Oron, Mitrofanis, in Alzheimer's models and in Parkinson's models, that you got this distal effect at the brain, that cognitive functioning improved, showing that the theory says it appears that you don't even have to directly apply the laser to the cranium in order to get a result. So the point with these is just to show you that the claim, our laser is better because it has higher milliwatts, especially when I look at the research, it's not well supported by independent research. It makes for a great sales pitch, but I'm not seeing the research available to support that position. And we found in the Lanza Flame 1, if you're trying to do wound healing, 8 milliwatts was great. You just bump up to 40 milliwatts, it's not as good. Gal et al., if you're delivering a dose of just 5 joules, if you take longer to do it, 21 minutes, you get improvements in wound tensile strength. But if you go just 5.5 minutes, you get no improvement over placebo. Castano et al. Found that 10 minutes at low power to deliver 3 joules gave significant benefit in the study, versus 1 minute at high power, same dose, gave no benefit. And this one's particularly important for those of you looking at utilizing one of these 2 lasers for brain cases, as we look at the same total dose, but you're doing one at lower irradiance for a longer time versus higher irradiance for a shorter time, that you got greater neurite outgrowth with the lower dose, irradiance means lower power for the longer time, versus when you increase the power for a shorter time, you got less neurite outgrowth. So that's important when you're looking at the brain. And this is a very important one I'm going to spend a little more time on. So this one pertains to a violet laser being used for a COVID infection. But the reason why I have this here when we're talking about the brain is this is talking about safety for the milliwatts that is being utilized. So they found that utilizing just 1.5 to 2 milliwatts was highly effective for COVID. Now, the Erchonia studies showed that when they tried to increase the milliwatts, that they started to get less of a result and eventually no result or a negative result. And their critical thing was, they said, because violet is so energetic, so much energy per photon at 3.1 electron volts per photon, that you have to be very careful with the power, with the milliwatts. And they actually recommended not exceeding low doses, low amounts of milliwatts on there. So this, because if you get the dose too high, here's what happens. You get the opposite effects. When you're at the optimal dose here, you're getting increases in mitochondrial function, ATP, cell function, decreased inflammation, and you get better neuroprotection. But when you start going over that 10 joules, as you can see on this graph here from this study, you start to decrease ATP and inhibit mitochondrial function. You increase oxidative stress and increase nitric oxide to an inflammatory level, and you can start getting cell damage, and if it's too high, you can get even cell death. So now let's take a look at some other conditions outside of just autism and neurodevelopmental issues, but still brain issues. This was utilizing the violet and red laser. This was done with an Erchonia laser, where they lasered over the carotid artery and the vagus nerve, and then they did quantitative EEGs to see if there was any kind of change that occurred. And the key things here is that this did show with the QEEGs that lasering only over the carotid and the vagus, that it caused a change in the brain. So again, showing you don't need the direct penetration here. You can do it distally with high energy visible wavelengths like red and violet. But this also showed that not only was a 7.5 milliwatt laser effective, it was also safe. I looked for Avant research on the red and violet, and again, I couldn't find any. But let's look at some other conditions. This was a study done by Erchonia on Parkinson's utilizing a 635 nanometer red laser at just 5 milliwatts for 10 minutes, 3 times a week for 2 weeks. And they saw improvements in gait, less freezing, better cognitive function, and less difficulty with speech. I couldn't find any research on an Avant laser for Parkinson's. This is for the green and violet, and the reason why I'm showing you this, I was one of the main researchers on this study, and our paper got published in a peer-reviewed journal. Why is that a big deal? Only about 12% of submissions are accepted. Many are denied because they don't meet the level of criteria. Our study was high quality enough that it met the criteria, and it led to the first FDA clearance for chronic neck and shoulder pain, and better clinical outcomes too with the green and violet, even at just 7.5 milliwatts on there. For Avant's research on the green and violet, I couldn't find any published studies on their green and violet. Peripheral neuropathy, another one I was one of the principal researchers on, and this one, 72.7% of the patients receiving a red and violet laser compared to people receiving a red and violet LED. 72.7 got at least a 30% pain reduction for this neurological kind of pain. And again, Erchonia tests out higher milliwatts, and they found that they didn't get better results with the higher milliwatts. That's why they settled on the 7.5 milliwatts. For Avant, I looked for studies on peripheral neuropathy, and again, I couldn't find any. So with the Erchonia research, there's 48 peer-reviewed papers. There's 24 unique and specific FDA clearances, and those are all non-thermal. Those are all based off of level 1 peer-reviewed published papers. So that's looking head-to-head with Avant. You have 48 published papers. Nothing is published yet on the Avant lasers. Nothing is on their website. Nothing's showing up on PubMed. I did find they do have one FDA clearance, and I encourage you to look that up for yourself. Look up the 510K clearance for Avant. You will see it as a substantial equivalent as a therapeutic heating lamp to temporarily decrease pain by increasing temperature. All of the Erchonia clearances are non-thermal. Multiple indications are studying, including neuropathy and including the autism study. Avant has a limited research pipeline. There's only 2 planned trials I could find, and neither of them are yet recruiting. There's no device-specific peer-reviewed evidence. There's no device-specific clinical trials linked in the FDA record. This is perhaps one of the biggest clearances that's out there, is Erchonia has a whole body clearance for postoperative pain. So this is important because then if someone asked you, why did you use that laser on the brain? Not only can you say there's the autism study, there's the EVRL study on the vagus nerve, but there's also a full body clearance for non-thermal treatment on there. So that provides more protection to you. So this brings us to the end of the video. And at this point, what I want to do is invite you to join in on my group on Facebook. Type in Dr. Gair's Laser Therapy Treatment and Marketing Secrets, and you're welcome to join there. And I hope you found this video informative and helpful, and that you'll find the group informative and helpful. And I wish you the best of luck on your journey as a laser practitioner.